What is a bone densitometer? A bone densitometer is a medical device used to measure the density of the bone. So the most common type of bone densitometer is a dual energy X-ray absorptiometry or DXA scanner. And DXA scanners are used using the low-dose X-rays to produce images of the bones. So these images can then be analyzed to determine the density of the bones, which can indicate the presence of conditions such as osteoporosis. And osteoporosis is a disease that weakens the bones and makes them more likely to break. So bone densitometry is also known as a BMD testing, which is short for bone mineral density testing. And BME testing is commonly used to diagnose and monitor osteoporosis, which basically evaluates bone health in other populations at risk for bone loss. A DXA scanner works in this following manner. It basically uses low-dose X-rays to produce images of the bones, and these X-ray beams pass through the bones, and the amount of X-ray that is absorbed by the bones is the thing that is being measured. So the denser the bones, the less X-ray is absorbed. Pretty logical. The bone densitometer then uses this information to calculate the BMD of the bones, or the bone mineral density. So during the scan, the patient lies on a table and the scanner moves over the area of the body that is being scanned. And usually, the part that is being scanned is basically the spine, the hip, or the wrist. The scan takes on a few minutes and it's pretty much painless. The results are usually available right away, and the patient can leave the clinic right after the test. So how about the results? How can you interpret the results? So the results of the scan are usually reported in terms of T-scores, which compare the patient's BMD to the average BMD, all right? And a T-score of -1 or above is considered normal, and anything between -1 and -2.5 is considered low bone mass, or in medical terms, osteopenia, and a -2.5 or below is considered osteoporosis. Okay? And it's really important to note that bone densitometry is not a diagnostic test for osteoporosis, but it does provide information about the patient's bone health that can help the doctor to determine whether a patient may be at risk for osteoporosis. Other factors to consider, of course, is basically the patient's history, the symptoms, and risk factors. Some of the renowned brands with this medical device are the following. You've got the GE Healthcare with a range of DXA scanners. You got Zeiss Meditec, they have a brand called Norland. And then Siemens Healthineers, they also have a range of DXA scanners. And then Fujifilm, Prodigy by Demetech, which is a compact and portable DXA scanner. But my mission is to figure out what is out there of newer technologies, medical technologies out there that are bringing about new features, especially to this medical equipment. So let's figure it out. What are the features out there? Some of the emerging features to advance the technology of the bone densitometers are like high-resolution imaging, QCT, which is standing for quantitative computed tomography. You're looking at peripheral densitometry, 3D imaging, lower radiation dose, and also portability, so compact and movable. And of course, we should honorably mention artificial intelligence, so AI enabled by advanced algorithmics. I'll expand more on this on other videos. That's all folks for this video. I hope it was valuable to you. If you like it, please share, subscribe, and also comment. Would love to know if there are other features for this MD, and if you know a specific brand that is pushing the wagon forward, please by all means share on the comments. Have a good one. Bye.